Good afternoon, everyone. My name is Wong Wei Wei. Today I'm going to present a topic about myocardial infarction. So today my objective is you all able to define what is myocardial infarction, explain the pathophysiology, clinical manifestation, state the diagnostic test of myocardial infarction, and then explain the medical and surgical treatment of myocardial infarction, and then explain the healthy lifestyle that a client should be adopt after the MI. So what is the definition of myocardial infarction? Myocardial infarction occurs when an area of heart muscle dies or is permanently damaged because of inadequate oxygen supply to the area. So this picture shows there is a blockage in one of the coronary artery, and then the blood unable to flow down to one part of the heart muscle and cause the heart muscle dies and damage. So what is the pathophysiology? So most of heart attack are caused by a clot that blocks one of the coronary artery. So we have three coronary artery, right coronary artery, left ascending descending coronary artery, and then left circumflex coronary artery. So the clots usually forms in one of the coronary artery that have been previously narrowed from changes related to arteriosclerosis. So the arteriosclerotic plug inside the arterial wall sometimes crack, and this trigger the formation of a thrombus. So a thrombus in the coronary interrupts the flow of blood and oxygen to the heart, leading to the death of the heart cells in that area. So this picture shows a normal human heart artery. It should be smooth, elastic, and then this one artery narrowed by arteriosclerotic plaque is full of plaque here with the lipid, calcium, cellular debris it narrow the coronary artery. So next, the damaged heart muscle losses is ability to contract, and the remaining hearts need to compensate for the weakening area. So prolonged unrelieved ischemic causes irreversible damage to the myocardium. So cardiac cells can be stand for about 20 minutes before the cardiac cells die. So myocardium is metabolic active so it can show the sign and symptom of ischemic between 8 to 10 seconds if there is a decrease of blood flow. So the clinical manifestation is the most common is chest pain. So the chest pain may radiate to the neck, jaw, shoulder, left side of arm and the back. So tachycardia means very fast heartbeat. Tachypnea means breathing very fast. Dyspnea is a difficulty in breathing, short of breath, nausea, vomiting, anxiety, because of sense of impending doom, means they scared they will die in MI. Dysphoresis means sweating, cold sweat, cool and motor skin, diminished peripheral pulse. So in the more severe cases, so patient may decrease in the level of consciousness. So there is few diagnostic tests. The first one is blood test. So serum cardiac markers are protein released from necrotic heart muscle. The protein most specific for diagnosis of MI are creatinine tropokinase and cardiac specific troponin. So CK, CKMB, TROP-T and TROP-I. So this is the normal level. If the serum cardiac marker is elevated, means there is damage to the heart muscle. Next is ECG. ECG can show ischemic tissues, provide an elevation in the ST segment and a peak T wave or inversion of the T wave. So this picture shows ST elevation. Usually it should be same line. This already raised about 2 blocks. Next is echocardiography. It can evaluate the cardiac wall motion. It may be useful in identifying persipients for ischemia such as left ventricular hypertrophy and valvular disease. If there is a block in left side, the movement of the wall will be lesser. So the chest. Next is chest X-ray. It may demonstrate complication of ischemia such as pulmonary edema. So the medical treatment for MI is thrombolytic therapy and anticoagulant. This initial therapy will be administered as an IV infusion of streptokinase and will be followed by an infusion of heparin. So thrombolytic agent is the drug that dissolve or break down blood clot, and then is the first line treatment for MI. So early thrombolytic administration within the first 6 hours of the onset, so it can limit the infarct size, reduce heart damage, and improve the outcome. So this is the picture of IV streptokinase. So surgical treatment, emergency coronary angioplasty may be required to open blocked coronary artery. Once the reopening of coronary artery after angioplasty is ensured by implantation of stent. This is balloon. Balloon is to dilate the coronary vessel, and then the stent usually is drug-eluting stent. So it will place stent to maintain the blood flow of the heart. So the surgical treatment, the second surgical treatment is emergency coronary artery bypass surgery. CABG may be required in some cases. If the cases is very, very difficult, doctor unable to open up the vessel, so doctor may suggest to do emergency bypass. They will harvest the vein from the leg and then to do a bypass in the heart. So the following step can help to prevent, but also can help patient recover from MNI. So they need to have do some changes in their lifestyle. So we would advise patient to do regular medical checkup so that doctor can manage the risk factor early to prevent complications that can lead to MI, such as hypertension, high cholesterol, and diabetic. So control the blood pressure, maintain the blood pressure less than 140 over 80 mmHg, and then advise patient to stop smoking, because stop smoking can improve the cardiovascular status and improve the high density lipids level. So advise patient to regular exercise to prevent sedentary lifestyle, and then maintain normal BMI within normal range is 18.5 to 24.9. If patient is overweight, we will advise patient to reduce weight. And then Eat an healthy diet. Reduce saturated fat and cholesterol intake with strategy to lower low density lipid level lah. So some we can advise them to see a dietitian. And then lastly, we need to manage our stress lah. So any question? No question. So I will ask you questions so that I know that you understand what I am presenting. So can you tell me what is the three main coronary artery?
Left arterial descending artery,
Yes.
left circumflex, and right coronary artery.
Yes, very good. Left anterior descending, left circumflex artery, and then right coronary artery. So can list me 3 signs and symptoms of MI?
Chest pain, tachycardia, tachypnea.
Yes, very good. So they got a lot lah. You just choose 3. Chest pain, tachycardia, tachypnea, SOB is the most common sign and symptom of MI lah. So last question, what is the first line drug used to treat MI?